This chewable prenatal tablet contains iron and folic acid, which are essential for pregnant women to maintain adequate levels of these nutrients. Iron helps prevent iron deficiency anemia during pregnancy, while folic acid is important for preventing certain birth defects, such as spinal cord defects, in infants. It is recommended for women of childbearing age to ensure they have enough folic acid, either through their diet or by taking supplements. It is important to take this medication as directed by your doctor, usually once daily. It is best to take it at the same time every day to help you remember. You can take it with or without food. If you have trouble swallowing tablets, you can chew this tablet before swallowing. Remember to follow your doctor's instructions and do not take more or less of it or take it more often than prescribed by your doctor. Chew and swallow this medication by mouth, usually once daily on an empty stomach, 1 hour before or 2 hours after a meal, or as directed by your doctor. If stomach upset occurs, you may take this medication with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication because they will decrease its effectiveness. It's important to use this medication regularly in order to get the most benefit from it. To help you remember, take it at the same time each day. If you experience constipation, diarrhea, or upset stomach, these effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, notify your doctor or pharmacist. Iron may cause your stools to turn black, which is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. A severe allergic reaction to this drug is rare, but seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned here, contact your doctor or pharmacist. In the U.S., you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. It's important to keep prenatal number 115 iron-folic acid tablet, chewable out of reach of children to prevent accidental overdose, as iron overdose is a leading cause of fatal poisoning in young children. If an overdose does occur, seek medical help immediately or contact a poison control center. It's also important to note that folic acid may affect certain lab tests for vitamin B12 deficiency, but it does not treat this type of anemia. Therefore, folic acid should not be taken alone when treating vitamin B12 deficiency. It's best to consult with your doctor or pharmacist for more information on this. It's important to talk to your doctor or pharmacist about any allergies you may have before starting this medication. This product may contain inactive ingredients that could cause allergic reactions. Also, make sure to discuss your medical history with your doctor or pharmacist, especially if you have iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, or vitamin B12 deficiency. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are breastfeeding, consult your doctor before taking this medication, as it can pass into breast milk. As always, it's important to follow your doctor's recommendations and dosage instructions for this medication. Take it at the same time every day to get the most benefit, and remember to chew the tablet before swallowing. It's important to be aware of how this medication may interact with other drugs you may be taking. Some products that may interact with this drug include certain anti-seizure drugs. This product can also decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of this product. This product may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this product. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, contact your provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to get help right away if you suspect an overdose. It's important to not share this medication with others. Your doctor may also want you to do some lab and/or medical tests while you are taking this product, such as a complete blood count or checking your vitamin B12 levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Remember, this medication is not a substitute for a proper diet. It's important to maintain a well-balanced diet, including foods rich in iron like red meats, especially liver, fish, beans, and dried fruit. You can also find folic acid and iron added to fortified/enriched cereals and bread. And as always, remember to take this medication as directed by your doctor, and if you have any concerns about the dosage or timing, make sure to discuss it with them. If you forget to take a dose, take it when you remember. If it's close to your next dose, just skip the missed one. Take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. Remember to store prenatal number 115 iron-folic acid tablet, chewable at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it as directed by your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.